compressed sponges are sponges that are compressed, and then when you put them in water, they're gonna inflate. Now with these sponges, I don't know if some kits come with the compressed sponges, some kits come with the ones that are already inflated. I don't know which ones you got. Either way, to make them last longer, I like to cut them in half. Now I have half moon circles, so it's one sponge for one person. Versus, right, so versus using two, and then you're wasting more sponges, you know what I mean? So that could be a way to make it last longer. You can purchase them off of Amazon. Sponges are in all genres. You know, they do have them in compressed. They have cute little heart-shaped sponges. They have, oval-shaped sponges. And yeah, so you can pick from different things. All right. So I'm going to go ahead and wrap my client's hair. So I'm wrapping it in the headband. Like this. So I have either the hand towel or the pillowcase, and I'm going to wrap it around her head, and then I'm securing it with the headband. So the other thing that I make sure that I have with me is the alcohol. So this, we have it on the counter over by the disinfectant. The disinfectant is the blue stuff in the spray bottle. The clear stuff is alcohol. So this alcohol is just to ensure that I don't cross-contaminate. So whenever I touch something, and I'm gonna or I go back and touch my client, I'm gonna spray my hands with alcohol. You can use this to also wipe down your products afterwards, to sanitize your products, and things like that. So it's also mindful to let your client know everything that you're doing throughout the facial. You have to remember, sometimes the client is a first-time client. They don't know what to expect. They're nervous. They're in a dark room. They're half naked. They don't know when you're coming or going. Seriously, so you need to let them know what you're doing, right? So let them know throughout the facial, you're going to smell some alcohol. I'm not putting any of this alcohol on your face. It's just me sanitizing my hands. The other thing that we do whenever you do a facial, we do introductory touches. And this introductory touch is when you put the back of your hands on their shoulders like this. This lets the client know that you're coming. So before you touch them, you're going to place the back of your hands on their shoulders like this. You never want to get your product and then jump on their face. Introduce your touch. Let they know that you're coming, and then you proceed with the rest. Whenever you're going to leave the client, if you feel like you have to leave and get more product or anything like that, you always put a little pressure on your temples, and then you leave. Pressure on the temples to leave. Back of the hands on the shoulders to introduce your touch.
Is there any specific reason, or just?
It's just courtesy. So the client knows. Remember, you have to think and put yourself in the shoes of the client, and you want to make sure that you don't interrupt their overall experience. And it's a sensorial experience. You're taking them through those different five senses: touch, seeing, feeling, hearing. And you want to be mindful of your touch. Be mindful all the times you're going to introduce your touch. And remember that everybody's pain tolerance is different. So just your touch alone and not letting them know that you're touching them could startle them, could cause anxiety, could, who knows? So you want to just let them know. And this is a way that you let them know without saying, hey, I'm going to touch you. You're just gently putting your hands on their shoulders. It's like a comfort kind of touch. Yeah. All right. Now, to begin. So first thing we're going to do is we're going to analyze the client's skin. Typically, you would look in their chart, take a look at what they wrote, looking at their health history, seeing if there's any contraindications, what medications are they on, what is their home care regimen, what foods are they eating, when was their last period, why do I care about all of these things? Because these things affect your health and they also affect your skin, right? So I need to know also your extracurricular activities. Do you go out into the sun? Where do you work? What kind of environment? Because that too can affect your skin. So you're getting all this information to kind of come up with the best course of action for your client, right? So you have cotton rounds in your kit, cotton rounds, and you can use this for your eye makeup removal. So this is a Dermalogica protocol. They take 3 cotton rounds and they put it between their hands like this. Then they'll take it and put it in the water, wring the water out. Then they're gonna take those cotton rounds and the pre-cleanse, that pre-cleanse cleanser that you have, that can be used as your first cleanse, but also this pre-cleanse serves as a makeup remover. The makeup remover. And so this can help kind of break down any mascara or any eye makeup as well. So what I'm gonna do is put these eye pads on her eyes here, and then use this third eye pad or the cotton round to wipe off her lips if she had lip makeup on. So what you would do is just kind of stretch the lips like this, and you're gonna do 3 wipes. 1, 2, 3. Gonna throw this away, garbage. Put it on there. Then I'm gonna take my sponges and put them in water. My other cotton round, I'm gonna wipe down. Let's say it's been sitting there, but I'll keep them there right now because I'm gonna do the analysis. I'm gonna wipe off this lip after I did the lip removal. Now I'm going to use my mag lamp to analyze the client's skin. So the cotton rounds are on her eyes. It's breaking down the mascara if she had makeup on. Now I'm going to analyze the client's skin. So I'm taking a 4x4 and I'm going to place this over her eyes. And these are used as eye pads. So we use the 4x4 for many different things. So I'm going to show you a way to use the 4x4s for eye pads. You would take the 4x4 and you would open it up one time. I'm going to fold it the long ways. And then I'm going to twist it in the middle. And then you place it over the eyes. This is called the butterfly fold. Butterfly fold. So now I'm going to take my mag lamp and I'm going to analyze my client's skin. Again, you want to let the client know what's going on. Some clients are very sensitive to bright light. Never turn this light on over the client's face. Always turn it on away from them. Let them know what's going on. So I'm going to let them know you're going to see a bright light is coming from the right side. So they know the light's coming, okay? If you turn it on over their face, the light flickers when it comes on, and if they have epileptic conditions, it may trigger an episode. So you want to make sure you turn it on away from them. So when you're analyzing the client's skin, this mag lamp helps magnify the skin so you can see things, 10, 30, 50, 100 times the magnification. So it allows you to see things that you wouldn't be able to see with the naked eye. What you're trying to identify is not only their skin type, but you're also trying to identify any skin conditions that may be at hand. We will go over that later in the course, but feel free to look at those chapters when you have any time, just to look at what some of those skin conditions may look like so you can kind of identify them when you're looking at the skin. So to determine if they have oily, dry, normal combination. So you have, 3 different skin types: oily, dry, normal combination. And your oily skin, the pores are usually larger. You have the characteristics of oil settlements on the surface of the skin. You may have blemishes, breakouts, comedones, which are blackheads and whiteheads. You may have some, zits and pimples, some papules, some pustules. You may have some hyperpigmentation with oily skin. It just depends because of the congestion. Those are other conditions that follow with that. With oily skin, because the pore size is rather large, that's when people want you to shrink their pores. What's making the pores large is the oil that's stuck in the pore. The skin is elastic, so the oil allows the skin to stretch out, causing the pore to look enlarged. So to decrease the size of the pore is to remove the debris that's in the pore. So you don't just want to press on the skin and push it out. You want to prep the skin to remove the debris to cause minimal impact on the skin, right? So as I'm looking at the skin, the other conditions that you have normal. Normal has a good oil-water balance to it. The pore size is pretty much medium to small. They usually don't have a lot of blemishes. They have perfect skin. That's what everybody's trying to get their skin to, normal skin. But normal skin also needs balance to it, right? So it's not that they don't need a facial. They just need to maintain their normal skin, right? And then you have dry skin. Dry skin is alopitic, it's lacking oil. So some characteristics with dry skin is you'll see flakiness, scaling on the skin. You'll also see that the skin feels tight. The pores are minimal, very small to slightly invisible because there's nothing in there stretching the pore, right? So there's nothing to kind of get out with extractions, but what they really need is hydration and moisture, right? So they're gonna need products that are moisture rich, right? And then you have combination skin. Combination is indicated by the T-zone first. The T-zone is your forehead, your nose, and your chin. Usually the combo skin, this is the oilier part of the face. So it may be oily in the T-zone, it may be normal in the T-zone. I rarely see a dry T-zone, but that can happen sometimes. And then the other part of the face may be in different skin types. So it may be oily in the T-zone, normal on the outer part. Oily in the T-zone, dry in the outer parts. If somebody has combination skin, you would label it as the T-zone is the leading skin type. So you would say the person has combo skin, oily to dry. That means the T-zone is oily and everywhere else is dry. Does that make sense?
Yeah.
If somebody has a T-zone that's different from the rest of their face, you can treat each zone separately. So let's say they have an oily T-zone but dry outside.
Mm-hmm.
You can do an exfoliation that's formulated for oily skin in the T-zone and a different exfoliation formulated for dry skin on the outside. And the same thing for the mask. All right? Okay. So looking at this skin here. Erica, I'm stretching the skin. When you're looking at the skin and analyzing the skin, things that you want to keep in mind is you want to look, feel, and listen. So you're looking at the skin visually through your mag lamp, looking for the signs of the skin type, the open or large pores and the characteristics that go with that. You're feeling the skin, feeling the texture of the skin. Is it rough? Is it crepey? Does it have an oil sheen on the surface of it? Does it feel very dry and tight? Does it feel hot? If it's hot, usually there's a lot of blood flow to it and it's more sensitized, right? So you're feeling. Your sensory nerves are most abundant in your fingertips. So that palpation is super important. So it really kind of makes my skin crawl when I see estheticians wear gloves throughout the entire facial because you can't really feel anything, right? You don't have to. The only time that you have to wear gloves is during extraction because that's when you may be exposed to bloodborne pathogens. Now, since COVID, people have been very with things, and so there were people that were like, I'm gonna wear gloves for the entire facial to keep my clients' peace of mind and make them feel like, you know, I'm paying attention to their health and infection control because we were going through a pandemic. So there may be people that are still uncomfortable with that, and in that case, you may opt to wear gloves throughout the whole facial, but that's your preference. You could just to, you know, find out, or maybe they may just, if they want that, they may be very vocal about it. Yeah. So I'm looking at her T-zone. And then, I mentioned the other part is listening. So you're touching, you're feeling, but you also want to listen to the client. So what you see and what you think is addressable in this treatment, they may want something completely different. Yeah. So you need to listen to what their concerns are, what their pain points are with their skin, and make sure that you guys both come to a happy medium. Does that make sense? Okay. I don't know if I'm in the way or not. All right. Okay, so I'm looking. So I'm looking at Erica's T-zone. I see larger pores in her nose, and they're kind of getting smaller as they get out to the forehead, and they're getting smaller as they get out to the cheeks and the chin. I'm looking at her skin. I see a sheen of redness, erythema, right? So there's a lot of capillary activity going on. I also feel and see comedones in her T-zone area. I see comedones in her cheeks as well. Ooh, she has some melia. Oh my, got some good stuff going on over here. All right, I also see a little bit of hyperpigmentation on the chin, above the lip, on the nose. I believe that's from sun exposure. Okay. All right, you guys can take a look if you want to look and see what you're going to look at when you're looking at the skin.
I have a question. When you were describing the like dry, it's like black and oil combinations, like oil or T-zone. What would you describe oily?
Oily skin.
Like what does it need?
Oh, oily skin needs a balance or to reduce the oil production. So you need to use products that are going to absorb excess oil. Clays, kale and clay, bentonite clay, things like that. Oily skin, they tend to have a little bit more bacteria activity as well. So they need ingredients that are antibacterial, like tea tree, benzoyl peroxide, and things like that.
And the comedones, and that's
Are they like related to
Comedones are whiteheads and blackheads. So those are oil congestion. Go ahead. You can look. Comedones are oil congested pores. So that's where you have oil that's congested in the pore. It's black because the pore is open and the oxygen turns the sebum or the oil black.
Yeah.
It's white because the pore is kind of closed, like a little bit of skin is migrated over the opening, keeping the pore closed so the oxygen doesn't get to it, so it keeps it white.
So it'll physically look white.
The one that's like looks like a white head, but it's
Oh,
You
Amelia.
know, like
So
the
there's
white
a white one there on her cheek.
Yes.
Okay, you see that really like kind of hard white like there? That's not a whitehead, that's more of Amelia, which is kind of like a whitehead. Amelia is a solidified oil impaction. So oil is a form of matter, and matter changes with temperature, right? So I like to use the example of ice. Ice, when it's really warm, it's liquefied and it's water. When it's really cold, it solidifies and turns into ice. Same thing with your oil and your skin. Under really cold or different conditions, it can solidify and get hard and like, not hard, but it can get kind of hard and tough and waxy almost, like, you know. And then if it's in a warm kind of condition, it can liquefy and kind of get kind of like liquidy, if you will. So with the Amelia, it's a hardened, almost like a sand granule, but it's oil, but it's just hardened underneath the skin. They're very hard to get out manually. So the only way that you can, not the only way, but a few ways that you can get it out is by breaking that skin. So some will use a lancet, like a needle, to create a superficial hole and then release the debris. In our state, that's a controversial method because, again, I don't know if I mentioned this, we have a scope of practice and it can't go past what they call the DEJ, the dermal epidermal junction. So you can't go past the epidermis. And when you're sticking a needle in somebody's skin, there's no way you can tell, right? So the other way that you can help with Amelia is through a granular exfoliation, because that's going to slough off the dead skin cells on top, release that dead skin off the top, and then it's going to be easier. Of course, in a combination with using steam, the change in temperatures softens the sebums, makes it easier for it to come out. And then the other way that you can help Amelia is through electrotherapy, which we didn't talk about it yet today. We didn't get far enough for it, but it's called disincrustation. That's the other part of galvanic. That causes a chemical reaction in the skin where it changes the salt in the sebum in the skin, the sodium chloride, to sodium hydroxide. Hydroxide, which is lye. So it's changing the salt and sebum in your skin, which has an acid pH, to lye, which is the alkaline pH. But basically that's liquefying the sebum, making it easier to come out.
It's all coming together.
Oh, is it? Are you connecting the dots? Oh my God.
Are blackheads like
Science.
are blackheads like just like really dark spots in the skin, or is it?
No, blackheads are oil impactions that have turned black. So the dark spots that you're talking about on the skin is hyperpigmentation. That's dark pigment in the skin, which is something different. Okay.
All right.
All right. All right. I haven't even started cleansing yet. Okay. You ready? Okay. So, based on my analysis, that's going to help me determine what my second cleanse is going to be. Because I looked at her skin type. What would you say her skin type is?
Normal.
Combination?
Yeah.
Okay. Yeah, and I would say yes. And I would say oily to normal because she's more oily in the T-zone.
Yeah.
And maybe
drier on the
normal, or
cheeks.
I wouldn't say normal here. But yeah, dry, oily to dry. And then she has that sensitized skin, so you also see that flakiness a little bit, the redness and things like that. So I have to monitor her as I do the facial, because if she flashes on me or turns red, I need to be ready to take off whatever product that's making her irritated. She has sensitized skin. All right. So now I'm going to take off the eye pads. I had her eye makeup kind of dissolving here. So to remove the eye makeup, I would lift the eyebrows, and I would basically wipe all the makeup down to her cheekbone, and then I'm going to wipe it up after I wipe it all down to the cheekbone. I ask my client to open their eyes, and they look up, and I wipe from the outside corner to the inside corner. Outside to the inside. Throw that away. Grab my sponges. Do a nice rinse. Okay. So now I'm ready to do my cleansing.